talk about the cannabis and saliva testing, and this interests me because, well, there are a huge amount of cannabis users in New Zealand. There's no doubt about that. We top the world in terms of users, but the government recently announced its plans to implement up to 50,000 random saliva tests, roadside drug tests this year, at the end of this year. And my question is, will that affect medicinal cannabis patients, so those people that are taking medicinal cannabis through the black market, which means they won't have a prescription or some kind of slip that they can say to the cops, here, look, this is me, it's legit. So what will that mean? Dr. William Parkyn is the medical officer at the Cannabis Clinic and joins us now. William, g'day, nice to have you on the program.
Kia ora, Duncan, nice to be here.
Yeah, so how concerned should we be about this? Well, for a start, let's just confirm that. How many medicinal cannabis users are there for all sorts of medical reasons that are accessing cannabis through the black market because it's been so damn difficult to get anywhere else?
Well, I believe the last figures I read were about 130,000 Kiwis getting or having scripts for medicinal cannabis, but there's certainly a lot more of people using cannabis out there, something in the realms of, I think, 590,000 was the last figures I saw from the Ministry of Health.
Wow. And not everyone will be sitting there with a nice pink slip that says, I'm immune from this because this is a prescription for something. Very few have prescriptions, right?
Yeah, that's right. Yeah, only a small percentage of that nearly 600,000 have plucked up the courage to come and talk to a doctor and get a script for their cannabis. So, yeah, there's a lot of people out there still seeing the green fairies and accessing their cannabis through the black market.
Yeah. So what does this mean then? So when they start these roadside saliva tests, do we have an idea when they're going to start? They did say end of the year. Do we know if that's still the case?
Well, it's with the Select Committee at the moment, and they're meant to report back at the start of December. And then, assuming it gets passed, then they'll start procuring the tests. And that could be a difficult task, but I guess it depends what they go for. So it's probably more likely to be next year, I'd say.
Yeah. Whenever they give a date, it's always later, isn't it? They sort of don't get their act together. But are these tests accurate? Where else in the world are they using these sorts of tests?
Well, they're using these tests or similar tests over in Australia and also the UK and Germany, I believe. But Australia is probably the closest or the most similar to us. And I guess to answer your question, they aren't terribly accurate as far as we know. The reports I've seen are up to 13% false positives and 10% false negatives with the test. And so they're going to be suggesting to do 2 tests. If one comes back positive, they'll repeat it, which will help get around that issue. But they certainly aren't nearly as accurate or appropriate as the alcohol breathalyzers.
Oh, these time resource stretched cops, with not enough of them on the roads apparently, and without the resources, have just been throwing, I reckon, a bit of a curveball here, because you've got tests that aren't that accurate. You have people that are sort of going to be arguing the toss. You've got some legitimate medicinal users without prescriptions. I mean, it sounds like a nightmare. I don't think we're ready to go, are we?
Yeah, no, I think you're totally right there, Duncan. The tests are meant to take between 10 to 15 minutes each, and so if you're trying to do 50,000 a year, that's a lot of time, a lot of inconvenience, a lot of money. But yeah, I think the main issue when it comes to THC is that they also don't show whether or not someone is impaired. So it's extremely likely that someone who tests positive on one of these tests is actually not impaired, especially if they've been talking to their doctor about the safest way of using their cannabis and they're following their instructions.
How long does it take for the effects of marijuana to leave the even medicinal cannabis to leave the body?
Well, it varies considerably between individuals, and that's part of the issue. But we have to start somewhere. So we give standard advice, and our advice that we give is quite conservative, where we'd suggest not driving within about 6 hours of using inhaled THC or 10 hours of using oral THC because it lasts longer in the body if you take it orally. So that's the standard advice we give. But in saying that, there's a lot of new information and studies coming out, mostly from Australia, looking at regular medicinal cannabis users and impairment when using the usual regime, because the more frequently you use THC, you build a tolerance to the psychoactive effects before necessarily you build a tolerance to the medicinal, pain relief, nausea relief sort of effects. And those studies are showing, in lots of cases, these patients aren't actually impaired at all, despite taking their THC, and most definitely being positive for it.
I can see this to be a field day for lawyers. There'll be all sorts of lawyers, pro-cannabis lawyers as well, who'll be saying, I'll take this pro bono. And this could end up in the courts, and the police could end up spending a whole heap of time. The state could spend a whole lot of time on this, and I just think to me it doesn't appear to be that clear yet what we're trying to achieve here, because it doesn't appear. It appears to be very confused. I don't think we're in a place for this yet.
Yeah, I guess I feel the same. I think there's a lack of thought put into it. I can see it being extremely unpopular, and lots of that is because 19 of the 25 drugs or medications that they're looking at are prescribed by doctors regularly, and the figures that were released in the regulatory impact statement said about 600,000 Kiwis are on some of these prescription medications. So that's things like opioids, benzodiazepines, stimulants for ADHD, the obvious illegal ones, MDMA and meth and that sort of thing. But there's a lot of Kiwis out there using these medications as per their doctor's instructions who could quite likely get pinged.